Hi, I'm Jason Bellamy here at APTA headquarters in Alexandria, Virginia. Over the next 3 days, the Clinical Practice Guidelines Development Workshop is happening. There are representatives from most of the APTA sections. There are about 40 people here working on almost a dozen topics. And I'm joined by Sandra Kaplan and Joe Godges to talk about clinical practice guidelines, why they're so important, what the workshop does. So Sandra, let's start with you, and let's start with that obvious question. Clinical practice guidelines, why are they so significant? Why are they so vital?
So a clinical practice guideline is really an amalgamation of what best practice is. And while there are many out there on medical management, defining what physical therapist best practice is not so obvious, and so that's why we need to have these done.
So, Joe, the APTA adopted a new vision to transform society. Are clinical practice guidelines and development of those, are they part of reaching APTA and physical therapy toward that vision?
I think they're a foundation. They're really huge of transforming patient care, and not only for patient care, but transforming our education about what should be taught or what's best to be taught at all levels, at basic level, at a residency level, a fellowship level, and also driving payer policymaker decisions. And also, these are a big impact not just for the United States, but they're impacting other countries, patient care, policy decisions, education in developing countries and other countries that have access now with the web to where these guidelines are posted on orthopd.org and jspt.org and
National Guideline Clearinghouse and in Pediatric Journal or whatever journal is publishing it.
So that's why it's important. So what happens at this workshop? What are we working on? How are we trying to move these projects along?
So one of the things that you should understand is that the development of guidelines is sort of the end process of evidence-based practice processes, but the methodologies for developing guidelines are being refined at an international level. And what we're doing is trying to provide the foundational understanding of what those processes are and to give working groups on topics an opportunity in small bites to deal with one of those processes and come up with a plan for their group, move on to the next group of processes, have them make decisions about how they're going to do that. By the end of this workshop, they walk away with a blueprint for their working guideline development group for how to move forward in order to produce one of these. It's a rigorous process, and it takes a commitment of about 2 to 4 years to get one of these done. So it's important that they have a good foundation that lays out a good blueprint for them.
Joe, can you give me a sense of some of the topics that are being worked on here and hopefully what this will lead to all this time?
Oh, there's some exciting ones. I mean, as they're describing them, I'm thinking, I wish that was done because I have those patients that I would like to have guidance on how to manage. But some of the topics that are post-concussion management. So the people that had, head injury in a soccer match or a football game, they're recovering, but they're not recovering quick enough, or they're persistent in having symptoms. What's the intervention for patients that have a mild traumatic brain injury to get them back to their sport, get them back to their work, get them back to working in the military, whatever it happens to be? That's one. Another one is on what's the best management for somebody who just had a total knee arthroplasty in the acute care, and how do you best progress them? What's the most efficient strategy? What's the most efficient therapy? Some good ones on.
So there's pediatric section is doing one on developmental coordination disorder. There's acute care section is collaborating with geriatrics, I believe, on early mobilization in the acute care setting.
Management of hip fractures and non-traumatic hip fractures. So the typical fracture that somebody would get, that's a little bit more elderly, senior, and what's the best physical therapy management for that condition? Venous stasis ulcers. What's the best management for that? It's kind of exciting things.
These are all diagnosis driven, but we actually have a group that's going to look at locomotion in people who have neurological conditions and what are the intervention approaches that would facilitate that. So it might cross many diagnoses, but they'll look at the most efficacious strategies for developing locomotion.
What's a little exciting about this is that you mentioned the sections, but for several of these guidelines, it's multiple sections coming together. So, for example, the post-concussion syndrome, it's the sports section, the neurological section, neurological PT section, and orthopedic PT section. So it's kind of a good collaboration of experts from different fields and putting things together. It's like for the hip fracture, another one's it's Academy on Geriatrics and the orthopedic section. So good working groups together. It's kind of exciting.
So we've got experts, we've got them looking at evidence, and we've got them trying to translate that evidence to get it into the clinic, get it to patients who need it most. To learn more about the clinical practice guidelines development, you can go to apta.org. Thank you very much, and we'll catch you later.